that also in the airline industry, because if the pilot doesn't communicate with the co-pilot, we already know historically what can happen. Remember, maybe historically, maybe some of you, a pilot failed to share with another pilot, the co-pilot, the pilot. He didn't know how to communicate. He was intimidated, sender, receiver, and failed to say, I don't think we can take off, sir. I think there's a plane coming in. Oh, no, we gotta go. We've got to go. I've got to get to wherever I'm going, and I'm gonna push the button of the airplane, and that 747 is going to take off. That was KLM. And already a Pan Am plane had landed. He failed to say, sir, no, we do not have approval to communicate, and we can't take off. Lots of lives were lost as a result of failure to communicate. So impact on wellness. You haven't seen communication. You just thought of physiology and psychology, and that's important too. But our inability to communicate effectively, and I'm going to say two words, sender, receiver. Sender, receiver. So as you're thinking, take a little note down and say, oh, do I need to improve my sender or my receiver? And am I able to communicate where people, am I understood? Because your presence matters. And if people don't understand you, your presence may not be very clear. So that's one concept in wellness, your ability to communicate with others. And here we go, we say relationships matter. Your ability to be seen and be heard matters. And your sense of wellness can be impaired if you don't communicate well. And how many of you have to communicate with a certain structure? Raise your hand. I have to do that every day. And if I'm not able to do that, I often may have to even go to Dr. Maria Tiena and share some of my thoughts. Because communication, lack of ventilation, and there was a very famous guy who said, loose association. Your inability to not get your words out clear, that can even lead to mental instability. And I know we got a lot of healthcare professionals here that are mental health experts. So we also know that we don't use those thoughts, but they were very inspiring. I keep them in my mind. Ambivalence. You don't really, well, that's not what they said. I said, well, yeah, that's what they said. And you didn't get it because you were ambivalent about who you are. So I always used to think of another concept. I'm all about concepts, I'm only thinking. The concept of being understood and the concept of understanding others, right? If you're ambivalent and you are not clear about what you want to say, that's going to impact who you are in practice. And how many of you get up every morning and you have a lot of challenges? I can't imagine that none of you would. All of us do. So we have to be very non-ambivalent about our environment. We were just having a conversation earlier with suicide, right? Suicide prevention and helping others that have problems with their feelings. Well, if we do not communicate with people very clearly, they may not see you as a resource that they can communicate with. And then they have ambivalence. They may not associate things very well. You may have forgotten another A that's very important, which is their affect, in really understanding who they are. And we're not always like this. Sometimes we may be angry. We may show that we want to be distant with others. And we fail to see those cues in wellness. For us, it's important that we see how we feel. So I'm going to share three concepts. We're going to write people into three concepts. What is he going to say? These concepts have always helped me recuperate from the biggest disappointments, the heartbreak. Has anyone ever broken your heart in many ways? Have you ever had heartbreak? Something that you really thought, and all of a sudden, people didn't see you that way, and it broke your heart. That's overwhelming. You could spend the next 3 weeks depressed. Who knows what you're going to do later? How are you going to cope? So I have these three concepts that always help me. Now, I heard some of you talking. I was out there, but I was paying attention. Faith. I heard someone say the word faith. That's very important. You got to believe. How many of you believe? philosophy is very important because there's three concepts. Today's the try day. I'm going to share with you three concepts that give me a sense of well-being consistently, even when others have let me down. Yes, my friends, human beings will let you down. They don't mean to, but they will. Friends will let you down. Your family will let you down. Lots of things in life let you down. So you always have to have a little reserve working with you and know that I'm okay, I feel good, and I'm still Billy. And despite what happened to me, I'm still good. So the try concept. Relationships matter. So the first one I'm going to throw out there is you have to have a relationship with you. How could you possibly have a relationship with anybody? You don't have one with yourself. Healthcare providers of all types are constantly giving and giving and giving and giving and giving a lot and giving and giving and giving until there is nothing else to give. Don't be one of those, because then now you have lost your objectivity in life. You have to learn how to give, because you can't give it all until there's nothing left, because then you won't be able to be a good instrument of goodwill. So remember that, a relationship with yourself. The other concept that works with me every time that I've had a wellness issue, and how many things can impact our wellness? Finances can impact our wellness, right? Back again to inability to communicate with friends and family, that can impact your wellness. How about your personal relationship with your significant other? Can that impact your personal life? And if you cannot communicate well, where's that going to lead? It could end up really bad. In fact, Dr. Etienne and I have worked in this foundation, and with among incredible experts. Many of you are here today because the Global Innovative Foundation is an amazing organization. We know that wellness can be impacted in our personal lives. So remember, take care of yourself, a relationship with yourself. So I'm going to tell you my concepts that I built since being very young that can protect me and cope me with wellness. Faith. That's the first one. Every time that I've had a letdown, I try to believe. And I'm not preaching here. I got my own thoughts. Lord, please know that you're number one for me. For me, it's Jesus Christ. And I'll never be ashamed of you. But it could be different for you, and I respectfully acknowledge that. Faith is very important. It has always helped me to maintain that sense of wellness. The next concept for relationship-based philosophy is a relationship with those that you serve. That relationship is special. The theory of interpersonal relationships. I thought it was going to be a theory, but I'll throw it out there. That sense of trust. Back again, who you are in practice. How you want to be seen, and how you're going to be this instrument of goodwill. And here's one concept. Can I throw another concept out? Explicit, judicious, conscientious. That is really the commensurate healthcare provider. Boy, that's a lot of weight. You see, I'm always working on my posture. Because when you have a lot of things, you tend to do this. And you can't help it because they're all there. And it's all, the power of the mind is amazing, right? Do not profess ugly words, right? I've learned that from great friends right here. And I give them a lot of credit. Profess your words. So, a relationship with them. I don't say the patient, but well, you're not all nurses running around taking care of patients. With those that you serve. That's important. So think of two concepts now. Servant leader. You are someone who is able to share respect, honor, and acknowledgement. To others' sensitivity issues. We don't want to call them problems. It's not judgmental. But you want to be sensitive to that. Culture. We talk so much about culture. You have to understand that there are individuals, forget the culture or what you think that culture is. There is that individual. What makes you feel hopeful? Sir, ma'am, how can I help? I don't know much about you. What can I do to help you? Think of it reversely. Bill, you don't know yourself very well. It may be time for you to ventilate your concerns. They're getting scattered, and you need professional help. Nothing wrong with that. So you're building a relationship with yourself, and you're building a relationship with those that you serve. As you're climbing that second step, second concept for me, and you may have heard these words before. They're nothing out of this world. I didn't come here to bring you some cookbook recipe that you can take home and Dr. Valdez cookbook recipe on wellness. Because as you think, you are very, very creative. So the second concept, faith, hope. If you lose hope, you may have a wellness issue because there's always hope. There's always tomorrow. You cannot have everything. You can't win them all, and you can't be great at everything. It's time for improvement and self-worth to know that there's hope to do better, that there is a better way. So we talked about faith, hope, a relationship with yourself, a relationship with those that you serve. That's the second concept. And the third concept that I really live by is a relationship with the community. Those that you care about. And I was just sharing with a great friend. I was born in the island of Cuba. Not wearing white shoes, but I usually do. I usually wear white shoes. That is true. We love to wear white shoes. I don't know why. Must be the Caribbean. But I will say this. I was sharing with Jean. You don't need to be with your family to love them. You don't need to know that they're your family to really care about them and to really be part of their culture. I am married to a Colombian. I didn't grow up in Colombia. But my family's gone, the one that I knew. And I have a whole new family. Some of you experts call that simple anxiety reaction. They show up in the ER, they may need a benzodiazepine and antidepressant. Let's not go there. This is about wellness. Too much thinking of yourself and me and me and me leads to too much preoccupation with the self to the point that you're going to be worried about your heart rate. Am I breathing? Am I okay? I need to go to the ER, call 911 because you've given too much thought of yourself. Stop there. Look outward. Develop friendships. Define that cultural moment that everybody talks about. So community. We talked about faith. We talked about hope. We talked about relationships that matter. The first relationship was with who? With yourself. Relationship number 2 with those that you serve. And it doesn't have to be that you're a nurse taking care of a patient. You are serving. Many of you do amazing things. I know what you do. You're always serving. Serving the community. So congratulations. You are doing well. The third we talked about is community. A sense of commune. Embracing others. That cultural, they used to call it cultural brokering. Right? Remember those fancy words in graduate school? Cultural brokering. And what was the other one? Cultural sensitivity. And there was a third one. But there was one concept that I loved, which is cultural inquiring. And that's when you really talk to a person and you say, I want to help you. I don't know what's important to you, but it sounds to me that you want to share things. So I want you to know that I'm here to learn from you and to help you, to give you some hope. No matter what it is, I'm always going to be here to support you as much as I can. No, I couldn't tell people that I wasn't going to stop. Am I dying? lived through those three concepts to self-heal. Whenever I have gone angry, and I can, I'm human, whenever I have felt despair, whenever I have felt let down, whenever I have not gotten what I wanted, whenever I may have even been selfish and I have impaired reality testing, I have looked at faith, I have looked at my God, I have looked at hope, and I have tried to see myself, what can I do to take away that pain and give it to others that I'm going to feel great about? Because at the end of the day, the one recognition that is most important to you is yourself. And you to be content with who you are in this world. When I do a lot of nursing presentations, I always finish, give it some thought, and think about who you are in practice. And I don't mean the healthcare commensurate professional. I mean the entire holistic human being. Who you are in practice means who you are in this real world. Wellness has a lot of time and a lot of thoughts. It takes a lot of concepts and it takes a lot of building maturity. And as you're embarking, find your three concepts. For me, it's faith, hope, and the ability to have charity in my heart. Give to others. I want to thank you in the Lunch and Learn. I hope that your digestion was well. I hope that my words were resonating with comfort, with hope, and with a sense of well-being. On behalf of Miami-Dade College, who I love dearly and I represent, the Florida Nurses Association South Region, and my wonderful colleagues, where is she? At the Global Innovative Foundation. Thank you so much for your time. It's been a pleasure to stand here with you, and I look forward to seeing you somewhere in this amazing South Florida community that we live. Thank you.
You guys can do better than that. Let's give Dr. Valdez a big round of applause. Yes, I was taking note, Dr. Valdez. You know, the concept, faith, hope, was my third one. Relationship, and the fourth one is charity. All right, thank you so much, Dr. Valdez. We appreciate you.
I gotta run because my boss is waiting for me. I gotta go back to work.
All right.
I love it.
Thank you.
You do well. God bless you all. Thank you.
Thank you, thank you, thank you. Always ready to share his knowledge, and we appreciate you. So we're gonna continue on because we have 3 more speakers coming up. All right, so the next one is my very own sister, Dr. Lumana Joseph. Dr. Lumana Joseph is President and CEO of Lumana Physical Therapy and Wellness Center, which she founded in 2009 to ensure equal access to quality rehabilitation and wellness services. With a holistic approach, she provides physical and pelvic health therapy, promotes active living, and leads educational initiatives addressing health disparities in underserved communities. I'm going to stop right now, but because we can go on, but let's say she's a past chairwoman of the Haitian American Chamber of Commerce of Florida. She was the second elected woman chairwoman. All right, it didn't happen that often, so you change it. Yes. So please put your hands together and welcome Dr. Lumana Joseph. Okay, maybe right here? Yes. And I'm telling you, my mom loves Dr. Lumana Joseph. We all do.
Good afternoon, everyone.
Good afternoon.
Okay, first of all, I just want to say congratulations to MJT Wellness for this health symposium because we need it in our community and we are not speaking about it enough. So I prepared a boring presentation, but from what I've seen, I'm going to make it lively by doing some exercises because after this meal, we need to exercise. So, but you have to listen to me for a few. So my topic today is diseases impacting our community, a physical therapy perspective. Physical therapy, we promote function, recovery, and quality of life. An overview of the community challenges. Health disparities in our community include social factors, education, employment status, income level, gender, and ethnicity. In all countries, whether you are low, middle, or high income, there are wide disparities in health status of different social classes. The lower a person's socioeconomic status, the higher the risk of poor health. The role of a physical therapist is to address disease impacting our community. Our goal is to identify common diseases, understand the functional impact, and explore the physical therapy strategies. Some of the common diseases in the musculoskeletal area are arthritis, which affect the joints. So most of the people will complain of neck pain, back pain, pain in the hips, the legs, the knee. So they would come to us so that we can help them with the pain management. Also, you have neurological conditions such as strokes, Parkinson's disease, and others. And then you also have cardiopulmonary diseases for heart disease, and also COPDs. Then you have metabolic diseases such as diabetes that's affecting our community a lot. So as a physical therapist, I see a lot of patients that are losing their limbs just because they cannot manage their diabetes. So it seems that people in the lower classes are eating poorly, thereby contributing to the overall increase in obesity, leading to increase in diabetes. The neurological effect that I've seen most are the strokes. I see a lot of young African American or Hispanic males, females, suffering from strokes because they are not managing their high blood pressure. High blood pressure is something that can be manageable if you know it and you know how to take care of it. I found that a lot of my patients, they do not know, they do not check, and they're not eating the healthy, balanced diet that they have to eat. So therefore, because the stroke is a silent killer, they do not know when they're gonna have it, you do not know when the symptoms gonna come. Some people have symptoms and others do not. So if you don't know what to look for, you can easily have a stroke. And once you have one, it's easy to have another and another, eventually you may lose your life because of the strokes. So you have two types of strokes. You have the one that's a blood clot in your arteries in your brain, and you have another one that's like a burst in the vessels. Stroke is the fifth leading cause of death and leading cause of long-term disability in the United States. Then you also have multiple sclerosis affecting a lot of people, and the Parkinson's disease is affecting our community as well. So if you want to learn more, I don't want to go into too many details because I know we're running late, and also I need you guys to exercise to move, so I'm going to skip a little bit. So as far as the diabetes, you have two different types, or three. You have type 1, which is they were born with it. Those are the kids that were born with diabetes. Type 2 is that was acquired from you not taking care of yourself. And the third one is when you are pregnant. Is this better? Yes. So I think, well, from the CDC, my source, it says 38.4 million people have diabetes, 29.7 million are diagnosed, and 8.7 undiagnosed. And complication can be to the point where I just mentioned that if you're not able to maintain your blood glucose level, eventually you're gonna start having neuropathy in your legs, and eventually you're gonna start losing your limbs. You usually start with 1 toe, 2 toes, 3 toes, a foot, and then eventually the whole leg. So by the end of time, it might end up killing you. So it is very important that we learn about the diseases. And I also noticed that because of the food that we eat, obesity is another thing that we have to combat in the community. Because we are not moving enough, and we are eating food that's high in carbs, and they're not providing the nutritional balance that we need. So we are gaining weight, and we have inactivity, and then because of that, we are getting bigger in the population, and we are, and the disease is just killing us. Another one I just added is cancer. Cancer was not part of it, but because I've seen cancer so much lately, that I feel like I need to talk about it, and then you guys have to understand because it's killing us silently, and most of it, by the time we realize that we have it, it's already too late. No, I'm not gonna stick too much in it. That's good to know. But anyway, as a physical therapist, I work in the hospitals also, so I see that there's this young woman that I saw one time. She's in her 30s, she has breast cancer. And it was already at stage 4. There was pus coming out of the breast and she was already blind. So to me, that killed my heart and she couldn't even move. So if we can do something about cancer, we need to, since we have another presenter that's gonna present about it, I'm not gonna go into detail, but we need to know the disease in our community that's affecting us, and we need to know how to stop it, how to eliminate it, or how to treat it better so that we can take better care of ourselves. I had a lot of cancer PowerPoints. So prevention and community outreach. We need to have more of health education workshops like the Lumana Foundation I founded. We do that a lot. I know Hannah does it, and I know so many other community organizations that provide education, training, and resources. There's a lot of challenges and barriers. I can talk about health disparities in our communities all I want, but if the people, they don't have the funds, they don't have the transportation or awareness, there's nothing they're gonna do about it. So I can come here like I'm doing with the Lumana Foundation. I'm gonna go from every quarterly we have a symposium where we gather people, we talk about different diseases that's affecting our community. So I think education is key, and then eventually if they don't have the funds or they don't have the means to eat well, then maybe we can connect them with other resources that can help them in that area as well. So physical therapy, we believe in moving. No matter what you come to us for, whether it's for pain management, we will take care of you. But if you don't move, you're not gonna be able to function. So now I know you had a delicious meal, but I am gonna make you all move because movement is medicine. Are you guys ready? Are you guys ready? I'm coming down. Ask everyone to get up from their seats. Oh yes. A music would be good. They will be moving. Stand up please everyone. It's time to stretch and move. If you don't have good balance, you may want to hold on to a chair, but we're gonna move. For the music. Oh, we need exercise music. We're gonna start with this one too, Mama. Everybody, do your chair out. Space to move. While they gather the music, this is what we're going to be doing. We're going to stand, and then we're going to sit. But we're going to go a little faster so you can feel it in your thighs. Okay, guys? We're going to do 10. Are we ready? Yes. Okay. Together, everyone. Let's go. 1. That's a good one. Faster. 2, 3. Yeah, for the knees. We need those knees. 4. Good. 5. There we go. 6.
my goodness. Let's get Dr. Joseph. Another big round of applause. I look good, but I'm not in shape. I gotta hit the gym. Oh, poor Marjorie. Okay, all right, we back. Yes, so now we're gonna move with HIV and STDs. And then we're gonna welcome Dr. Cassandra Espera. Yes, read a very, very short bio because all the information is in the booklet, but my beautiful sister, Dr. Cassandra Espera, PharmD, is the CEO and founder of PrepRx. Okay. PrepRx, and known as the all right. The PrepRx HIV pharmacist on Instagram. She empowers communities affected by health disparities and expands access to HIV education. Dr. Espera is also a founding board member of SPARK, a women empowerment group. Fun fact, in high school she told her chemistry teacher she didn't need this class because she was going to law school. Woo, okay girl. And she needed more than chemistry. All right, so put your hands together and welcome Dr. Espera.
Hi everyone, how are you guys doing today? So after all that fun, we're gonna switch the subject back to wellness, right? We're gonna talk about, it's something that we don't talk about enough in our community, right? And a lot of communities, why? Because there's a lot of stigma when it comes to HIV/AIDS. I had slides prepared, but I'm not gonna use the slides, but I just wanna use the second slide in my deck. Could you guys put the slides up for me? Yeah. Okay, so does anybody know what the difference is between HIV and AIDS? What, yeah, I saw you raise your hand. Don't be shy. What's the difference? Right. Exactly. So HIV is the virus that causes AIDS, right? So the point of the story is you have to get tested. So anybody between the age of 13 and 64, it's recommended that you get tested, right? So regardless of what the outcome is, there's always a prevention solution, right? So there's something called the status neutral model. And the reason why it's important to have this conversation, because I don't know if you guys know, this disease state has been around since the 80s, and it's highly stigmatized, right? So I myself, I was born in Haiti, came to the States at 1 year old, and I remember being 5 years old and watching the Haitian community in New York protest because we were not allowed to donate blood because we were one of the 4 H's. Have you guys ever heard of the 4 H's? Okay, so for those of you who've heard of the 4 H's, can you guys name Marjorie, which is one of the 4 H's? Haitian, right. So at one point, the cardinal target populations for people who they said were HIV diagnosed or potentially were, number 1, Haitians, homosexuals, heroin users, and what was the last H? I can't remember right now. Huh? Anybody know? Haitians, homosexual, heroin users, and what was the last H? I can't think of it right now. Haitians. I can't remember the last H. It's on top of my head, but. Huh? Everybody's Googling ChatGPT. So as you guys are looking that up, so we don't have my slide. So the point is that between the age of 13 to 64, you get tested. Hemophiliacs, yes, hemophiliacs, right? Because people who donated blood and they didn't test the blood were able to contract it. Hemophiliac, that's important. That's Ryan White, right? It's important story. So with that being said, so let's say that you get tested and you find out that you're HIV negative, does anybody know what you can utilize to prevent yourself from getting HIV if you test negative and you know that you may be at risk? PrEP. What is PrEP? Does anybody know what PrEP is? It's called pre-exposure prophylaxis. So it's a medication that you can take before you get exposed to HIV to prevent yourself from getting HIV. We have once daily agents, and now we have long-acting injectables. We have an injection that you can get every 2 months, and guess what? Just this year, a few months ago, they came out with an injection every 6 months. You can get this injection, and it can prevent you from getting HIV. So again, there's no excuses for getting this HIV today, right? Because there's so many things on board. And let's say that you find out that you get tested and then you test positive. You get on medication, and right now we have once daily agents, we have every 2 months agent, and pretty soon in the pipeline we will have every 6 months injectables to prevent HIV. Pretty soon, they're working on it. So it's come a long way. And when I say this, for HIV, being on medication and having a viral load less than 200, that's prevention. Why? Because undetectable equals untransmittable. Right? So being on medication and being undetectable will prevent you from transmitting HIV to your sexual partner. Right? So with HIV, what it is that once you take your medication, there's just like a little bit of the virus that they can't figure out how to eliminate. And if you stop taking the medication, the viral load will go up again. So this is super important because I go to all these wellness events, and this is not something that I hear that we talk about in a lot of the communities due to the stigma, right? So a lot of times there's mobile units that come, right? And people may not want to get on those mobile units. I want to hear the community's ideas, like how can we spread this information and how can we make people comfortable getting tested? Can anybody share that with me? Because I think this is an important conversation that we don't have enough. Does anybody have any ideas on what we can do? Radio, yeah, I'm always on your radio station talking about it with Hannah all the time. That's true. Absolutely. Exactly. Right. Exactly. Yeah, I always thought about that, like maybe like the events like Sounds of Little Haiti, maybe a ticket to test or something like that. Yeah, I have so many ideas, but we all have to come up with the ideas together. What is your idea?
I remember back in the days when HIV and AIDS were just rampant, and I had passed away at 33. So I remember high school, middle school, they had pamphlets to really discuss the different HIV, STDs, and it was a real, at that time there was a lot of education going on, a lot of awareness happening. So now, if you look at it, they don't even have sex educations really. And they're not really talking to the teenagers about sexual transmitted disease. And also, the conversation's not happening a lot, where they're not even addressing that Black women are one of the highest with HIV and AIDS. How Broward, Miami-Dade, we're leading the nations with that. Yes, among ourselves we talk about it, but when we're sitting down having conversations with, at an event or just talking, people don't see HIV and AIDS as a threat, where they will talk more about diabetes and chronic, because that's what we talked about. That's part of our health maintenance, right? Prevention. So where HIV and AIDS, it's, okay, I get a pill, but what happens with that? And back in the days, usually make sure that we check ourselves, and then before you have your sexual partner, you share report cards. Now you share report cards, and it's not even detected, but is that person really telling you the truth? And another thing too, if you females, we're more likely to go to the doctors than men. So that mindset of like, oh, you know your status, I'm okay. But we also need to educate the men as women in the healthcare, know your status as well.
Thank you. What she says is true, right? So when you speak to the fact that there's a tremendous amount of women who are being diagnosed with HIV, but as Black women, the reality is we are having less sex, but we have a greater incidence of HIV. Why? Because our community, right? Black women, we tend to not date outside of our race as much as other communities, and that even though we're not as, because people always like to connotate HIV with like maybe have multiple partners, and that's not necessarily the case. Most women who contract HIV do not have multiple partners, right? So these things, these stigmas need to be eliminated, which is why we like to have this conversation of status neutral, because that can help eliminate the stigma, right? So that I would love to see one day in our community, and I know Marcel can speak to this, with working in HIV/AIDS, Ryan White, AETC, where people celebrate being undetectable. Oh, I've been undetectable for 20 years. I would like other communities to reach that point as well, to where we can have a panel with people who are diagnosed to have that conversation to save our children. Because the people that are younger, these Generation X, they don't understand the impact of HIV. They weren't around in the 80s to see what was happening. They don't take it seriously. Like now, all they know is they can take one pill a day, and they can, some people never get AIDS anymore, right? Because if you get diagnosed early and you take your medication, you may never see AIDS. So AIDS is untreated HIV, right? So I would love to see that this conversation happens more often at the health fairs, and that it's a more common conversation, because it's so important. And having a sexually transmitted infection such as syphilis, gonorrhea, or chlamydia, I don't know if you guys are aware, but that actually increases your chances of getting HIV, right? So I worked in a clinic before, so now I'm in pharma. I'm a medical scientist for a drug company now, but before that, I was working as a pharmacist at the AIDS Healthcare Foundation, who took care of all the STIs for all of Broward, right? So I'll go in and I'll see all these women coming in for STI treatment, but then when I go to the PrEP clinic, it's usually the men who have sex with men, the white and the Hispanic. But the reality is, the same demographics that's in the STI clinic should be in the HIV prevention clinics, but that's not happening, right? And another part of the story is we have substance use, mental health, and people like Marjorie Lozama, who's taking care of that mental health, because until people take care of their mental health, whether it's HIV treatment or prevention, and both of them are status neutral, which is prevention, when people are not in their correct state of mind, they tend to be sometimes and get into situations that may lead to that also. And also, when someone's diagnosed, you gotta think of that mental health, right? So before you start talking about medication adherence and making sure that they take their medication, you have to think about the whole wellness, which is all the conversations we're having today is so important. So the point is, between the age of 13 and 64, you go to your primary care doctor. Please do not assume that your primary care doctor is doing that test for you. You guys have to ask. Don't just assume that the doctor said, oh, I have a clean bill of health that they did an HIV test, because that's not the case, right? Most of the times, for whatever reason, it has to be an opt-in test, which I think it should just be standard. But yeah, that's definitely the conversation I wanted to have. Does anybody have any other ideas? Because I know we're running late. I had a PowerPoint slide ready and had to pivot. Does anybody have any questions? Because I definitely want to know some ideas. Yes.
In my case, more than a question, what would be your advice? My oldest son is 23 years old, lives out of the state, is dating a new girlfriend. They're, of course, planning already on becoming intimate. How do they have the conversation, let's get tested, or how should me as a parent, or how in our communities, make it easy for our children to talk about it?
I love that you brought that up. That is so important. So I mean, I guess just empowering them with the tools and just having the conversations, right? Because we know the only thing that prevents sexually transmitted infection is a condom, right? So even though that you take the prevention medication, that's not going to prevent STIs. So maybe you can start the conversation from there. Like, oh, have you heard about this? I learned this today, that there's an injection that you can take every 6 months to prevent HIV. Have you heard about that? Have you ever thought about getting tested? I think it's so important to just be open about the topic, or maybe just approach it from the perspective of, did you know that? Did you know that? I just learned that today. And then maybe that could open the door to having other conversations with them sharing. Or even if you're not ready, I just wanted to talk to you about that. Does anybody else have some more advice for her? Because I love this topic. I'm going to come to you after.
I don't have an advice, just make sure that they talk about let's go to do our checkup together. Just make it an annual thing. And just pretty much go into talks. Because again, it's not only HIV, like you mentioned, STDs. And once that gonorrhea or chlamydia, that's like another pathway for the virus to go in whichever. So it's a great chance for them to just talk about it all together and make it like maybe a date night where it's just easy to talk about. But my question, not a question, but like you mentioned, like they do celebrations of those that's been HIV for 20 years undetected. But there's also a lot of kids or adults now that were born with HIV that is in their 30s and 20s, that are living and getting married, and nobody talk about that. So that's a great thing. I don't know if they're even documenting those, how long they're living, or if they're having kids that have HIV, and how does that look like?
And also, health departments provide free at-home test kits that you can, MJD Wellness, right? You guys do testing. Take them to MJD Wellness. They're out in the community testing and doing the work. So you guys have the resources right here. Do you guys have at-home test kits also? Or at the health department? Do you guys give out at-home test kits? Oh, no. No? Okay. But that's another opportunity too, just like an at-home test kit. If you're not ready to go to a facility, you can always have, there's organizations that send them for free.
So just to give parents advice, we have a hard time talking to our kids about sex. And the only reason we do this, and this came from a friend of mine that's a sexologist, and her professor did a study between Sweden and America. Why is it so difficult for American parents to talk to their kids about sex? It's because we're only thinking about intercourse. So yeah, we do find it difficult to tell anybody under the age of 10 about sex, or even at 15 about sex, because we're only thinking about intercourse. So if we reframe the conversation about how you feel, do you respect yourself? Do you trust yourself? Does the person respect you? Do you trust them? If we don't, we have to start turning the conversation more internal, so that when I do decide to have sex, I'm making that decision and not being pressured. When I do decide to have sex, I'm in touch with what that means to me, and it's not just that physical act. So we have to change that frame and make it more easy to talk about, because I'm 61 and my parents ain't never talked to me about sex.
And I know from the community I'm a part of, the Haitian community, they feel like if you talk about it, that means you're inviting them to do it.
And I want to jump on that. There's a term that we use, harm reduction. I don't know if you guys ever heard the term harm reduction. I think we need to start having more conversations of what harm reduction means, because culturally, wherever you are, do I give my son condoms and my daughter condoms? Not saying I want you to go have sex, but if I'm not going to be honest and open with you and give you these condoms, and you decide to do that, then what? Then I come back pregnant, or then I come back with all these other issues. So we need to start opening up that word harm reduction and plant it, like we need to talk more about these things.
I love what you said, because that brought me to the conversation, there's a lot of kids that are not able to share their sexuality with their parents. So let's say that you know about HIV prevention, you know that you can get that injection every 6 months, but then you don't want your parents to know your lifestyle. So you never get access to these medications, even though you know, and then what happens? You seroconvert and you get HIV, right? You get diagnosed with HIV. So I love the fact that you brought up this question about how to have that conversation, because I think that's where it starts first, and that's how it can change generations.
Have a hard time talking to your kids about it. You can also just get them a book, as a gift. you know, wrap it up and give it to them during the holidays. As I give gifts to my older kids, and then we have the conversation after that. You just ask them what they read, or you can just like do little assignments.
You don't remember? But I think that's a good idea. Yeah, then you can have like a book club. I love that. Or just send them all to the cool auntie.
So another thing that just came to my mind, because I used to work with middle school and high school students for 5.5 years, there is a lesson, I think it's called the Steps of Intimacy. And it was more an activity based, and each card has, you know, like physical touch, you know, touch below the waist, you know, all that kind of stuff. So they have to like put themselves in order what they, you know, what the right order is. Then the question I asked, 2 questions I asked at the end is, how far is too far to go with somebody that if you were to break up with them in that moment? Like, you know what I'm saying? And then the second question, this is where the double standards come in, mostly for the boys. The second question is, I asked, well, 2 questions and not 1 question. I asked everybody, if you had a teenage son, just like you're a teenager, if you have a teenage son, how far would it be okay for your son to go with another girl or another person? And literally 98% of the answers that I get from the boys, they be like, oh, all the way, or this and that, like literally all the way. But the moment I ask, if you had a daughter, same age as your son, how far would you allow for her to go with another man? Well, they can't even stare at each other. The point I'm trying to make is that another type of conversation to have is teaching these young boys or these young men what it is to value another woman or another girl. And unfortunately, you know, many of them probably don't have that male figure in their life. They don't have a father for whatever reason. But people like us or other men or the schools that could...
No, I think, we moved the time. We're gonna finish early today, right? We moved the time. We're gonna finish early today, right? So, my Madam President is gonna take a sweet time. No, I'm kidding. All right. Also, I have the President of Women of Excellence is here, Griselle Lozana, my sister. All right. And yes. And then stay tuned for January. Something's coming up in January for Women of Excellence. January, yes. And second week, not too much going on. November, it's Madodo. I'm gonna put a shameless plug. There's a gala, MJD gala for tomorrow night. Everybody registered for the gala for tomorrow night? Yes? Okay, did everybody donate it? You use that QR code to donate and support MJD, the work that they've been doing in the community for the past 10 years. So don't forget to do that. So at this time, we're gonna move to our next speaker. She's gonna be talking about breast cancer awareness and prevention. It is my very president of the Haitian American Nurses Association, Myrnelle Fleur-Aimé. She has a dual certified nurse practitioner